We are talking the best apps that I use as a doctor. So we have 8 of our best apps that we use every single day. Well, almost every single day as a doctor. As you guys know, we pretty much carry around these phones with us all the single time. Doctors in the 21st century use technology like there's no tomorrow. And the one bit of technology that we always use is our phones. So to have the most up-to-date and useful apps is so time-saving for us. Let me go through some of the ones that I use every single day. Now, I think the first one is the MDCalc. It's a game changer. Everyone knows it, everyone loves it. We use it for countless different things. All right, I'm gonna screen record so you guys can follow along. Essentially what it does is it has a whole bunch of verified calculators for various things in medicine. The app is really easy to use. On the home page that we're looking at right now, we can see the popular ones that we are using. It has like the stars along the right hand side, which you can favorite if you tend to use these ones quite often. You can look at the new ones that have just been created, and you can then go based on the specialty, or you can just search it up here. One of the most common ones that we have is a Wells score, and essentially the Wells score is, you can use one for the risk of a blood clot in the legs, which is called a DVT, or you can also use it for the PE as well, a blood clot in the lungs. Now, it just pretty much has a whole bunch of questions that you can go through. So, does the patient have cancer? Have they been bedridden or have they had surgery? Do they have like some swelling of their calf or other leg? Let's say yes. No. It's a little bit painful. There's no swelling. Maybe they have had a previous DVT in the past. And look, it gives you a score. So for this patient, we've scored 4 points, which is a high risk for a DVT. So a score of 0, score of 1 to 2, score of 3 or higher suggests DVT is likely. So it's a very high pre-test probability, and they should receive a diagnostic ultrasound. So we wouldn't do a blood test in this case. We're going to go straight to an ultrasound to see if we can find the clot in the legs. It goes through the evidence. It goes through the person who created this particular scoring system and how it calculates the points for the system. Getting a lot of messages now. I'm going to turn this sound off. So yeah, look, that's just the Wells score. There's a whole bunch of other things that are on here. So MDCalc, look, we use it every single day as doctors. Just really handy to have, because if you need to calculate something and make a clinical decision, you want a verified scoring system to do that with. So one thing in medicine that we have been taught now more so than ever is because there's such a massive amount of information out there, you can't remember it all. So the one thing that you should know is where to go to access that information. You should be acting as sort of like a librarian who knows where to look for a specific topic. You should have a really good base knowledge, of course, but it's just completely unreasonable to know everything off the top of your head. That's MDCalc. The next app that we've got is, what should we pick? Let's pick the eye manual. This is a bit of an interesting one, but I found this really helpful in my ED rotations. It is generally helpful for anyone who's experiencing any particular eye problem, and makes it really simple, because I know eyes can be a bit tricky. You can go to the specific presentation. So maybe they have a red eye recently. You can look through, it actually gives you some pictures of different conditions with the eye that could cause it. So, maybe it's red all over and it looks something like this. This might be an allergic conjunctivitis. Through the history findings, the treatment for it, gives you some more information, and actually gives you some questions to ask and questions to make you think about what's going on with this particular patient. They go through like the specific conditions, but I think the most helpful with this is this diagnostic tree. Look, the diagnostic tree is super helpful. It helps you work through systematically what could be the cause. So let's say the patient has a red eye. That's the main symptom. It's red all over, so we're gonna go diffuse. They say it is painful. Does it disappear with tetracaine? Like, tetracaine is like a local anesthetic, so does the pain get better with it? Usually it should. Let's say it does, just for this particular case. Are they itchy? Maybe they are scratching at it a fair bit. And there we go. We could actually have this patient with allergic conjunctivitis. So then you click on that particular thing again, and then it points you to the specific treatment for that presentation for that patient. Of course, you can't use this as your complete diagnostic workup. You need to take everything into consideration and do a full examination, etc. It even goes through like the different types of assessments you can do for an eye. For instance, how to check visual acuity, goes through the specific steps, gives you like really easy diagrams to understand, and then the specific numbers and testing that you can do for that. Oh yeah, they show you how to like use like a slit lamp. They have like links to like videos and everything. I just find it super helpful because anytime I was in the emergency department, or anytime a patient comes in with an eye problem, you know, maybe they've got like a new vision impairment, maybe it's a really painful eye or a red eye, just to do a full proper workup and have a general idea about what it could be is super helpful before you refer to some like the specialty like ophthalmology. That's my second app, the eye manual. Super handy, and I like the visual aids for it, you know, pardon the pun.
No pun intended.
You clearly intended that pun.
All right, next app, we're gonna go to Toxicology. Now, this one is one of these Australian ones by a hospital, Austin Health. So look, it has all the specific things that people could overdose on or become, you know,
Ready?
any particular thing that could act as a toxin, it goes through and tells you what to do, what the signs and symptoms of an overdose are, and what you can do to measure how bad it is and the specific treatment involved with it. Let's pick a random one. Let's say escitalopram. Okay, this is not uncommon for people to take too much of. It's a really common drug. People use it for, you know, things like depression and anxiety. Goes through the, you know, risk assessment of it, you know, the clinical features, what they appear like, and then what you should do to manage these patients who come in with an overdose of this particular medication. They're usually benign, but they can be associated with QT prolongation and torsades de pointe. The main thing to get from that is that it can cause some heart problems if they're really severe, but usually you don't have to do too much. It just has so much information. It's just super, super helpful. Of course, if you're ever like unsure or just want to clarify, they have like a poisons hotline that you can call. I've used this a couple of times. One patient I remember seeing who had been exposed to a particular chemical that was like an inhaled chemical. It was some workplace incident, and we actually didn't do anything for the patient, just sort of monitored them for a while and just confirmed with the poisons hotline. It was such a weird drug, we had never heard of it before, that we just wanted to clarify we're doing the right things, and they are so nice. Anyways, Toxicology app by Austin Health, that's number 3. Again, all these are super helpful. So the next one, it's probably my favorite one that I use, and I probably use this one the most ever. It's my notes app on my iPhone. So even if you're an Android user, they should have a specific area where you can make some notes yourself and store them in your folders. So look, I really like these because if you want to write some things down freehand of how to manage a certain condition, or maybe it's like you want to write down specific investigations to order for a particular medical condition, you know, for instance, what to do if a patient has a fall, how to assess them, what investigations to think of, how to manage them after the fall, and what to check on. I mean, I don't really use this now. You can see I made it in the 1st of June, 2022. I think I was just starting my general medicine rotation around that time. And, you know, we had a lot of elderly patients who would fall, and you get really good at the workup over time, but just when you're starting out, it's really handy to have something that doesn't use any internet, because you don't want to be stranded. So to have this, you know, free text information, just some notes on your phone, is one of the best, most helpful things for a junior doctor. You know, there's a lot of other things on here, you know, what to do if you have a blocked catheter, the causes of it, the questions to ask, what to do, and how to fix it. Yeah, that's just something that I like to use and just to have there. So if I really need to write something down and remember it, it's just super easy to access. You can just search it on top of your iPhone and store all that handy information at the tips of your fingers. So yeah, love that. That is probably my favorite, most used app on my iPhone. All right, we're going into number 5, is called ETG, otherwise known as the Electronic Therapeutic Guidelines. Look, this is a app specific to Australians. The UK have the NICE guidelines, which is essentially, yeah, the British version of the ETG, and up-to-date's the US version of the ETG. For some reason, it is not letting me log in, which is very, very frustrating, but I'm gonna go through this on the computer instead. Anyways, the way the ETG works is it pretty much has up-to-date guidelines for specific medical conditions, presentations, treatments, everything for an Australian specific setting. And of course, within Australia, there's hospital and state-based guidelines that you should always follow if you're working at a particular health service. But if you're looking for a broad stroke, general approach to certain conditions or presentations or whatnot, I would suggest go to the ETG first, because a lot of the hospital-based guidelines are derived from the ETG. So that's a really handy thing that we as doctors use. We're not expected to remember every single treatment and management step in the pathway to every single medical condition. If you specialize in an area and you need to learn a bit more, or a patient has a particular problem that's associated with another specialty, you should do a little bit of reading or general research on that condition as per the guidelines before you end up consulting with a different specialty. So look, ETG is great. It has, you know, treatments, it has specific doses of medications, it has different steps and stratifications for people coming in with a range of medical conditions, and it's just getting bigger and better as it keeps going on. So it's only going to become the standard practice to have all these guidelines and all this information just delivered in a really concise and digestible manner. It honestly, in a way, replaces some textbooks, because you really want the up-to-date practice guidelines. When a textbook is, you know, made, it's first the idea is conceived, then it has to be written, then it has to go through all the publishing and editing steps. And by the time it's actually come out, it may have been 2, 3, 4 years, and maybe some things have changed before then. So it's really good to have like an up-to-date online guideline that helps your practice every single day. And I think, fun fact, it actually used to be a book. So it just used to be called the Therapeutic Guidelines. And then only recently, I need to figure out the year, it was made into the ETG, the Electronic Therapeutic Guidelines. So there you go. ETG, one of the greatest apps. We are going to, now back to apps that actually work. This app is called Emergency Procedures. I really like this app. It's only one I found maybe sometime last year, I think. And it gives you a whole bunch of specific, you know, procedures and videos and guidelines about how that particular procedure would be done. So for instance, if you're looking to do a chest drain insertion, let's go to this. So a chest drain is like a tube that you put in someone's chest for a range of different reasons. I mean, you can see the indications there. A pneumothorax is one, which is where there's air in the space of between the lung and the chest, or a hemothorax is essentially blood instead of air in that same space. Goes through when you wouldn't do it, the contraindications, some of the alternative options, and the potential complications for the procedure. It goes through the specific equipment that's involved, how you position the patient, the medication that you would use before the procedure takes place to sedate and anesthetize the patient to make sure they're comfortable when the procedure is taking place. We don't do this if people are still in pain and everything like that. We try to make them as comfortable as possible, and essentially just walks you through step by step how you would do it and then what you would need to do afterwards. Gives you some handy tips and really just talks about it and provides some really up-to-date references about what was used to manufacture. So look, it has a whole bunch of procedures that you can use. They're super, super helpful. Let's go through one more, which actually has a video. I mean, something as simple as a mobilization, a long arm back slab. A back slab is essentially a bit of like casting. It's sort of like plaster that they put on, but it doesn't wrap around the whole arm. A back slab just goes on the back of the fracture, but they actually have a nice little video here. I'm going to turn off the audio. Goes through how you do it, the specific technique and the equipment and everything. And then it just shows you people actually doing it. I mean, a lot of this is you just have to see a procedure being done first, and then you can try to do it under the supervision of a really experienced colleague. Yeah, a lot of medicine is really just being exposed to the right procedures and the right clinical presentations, the right presentations and the right conditions, and then you actually get a really good grasp of it. So this is one way to sort of expedite that process. And yeah, you don't often get a whole lot of medical videos about different procedures being done, so having something like this which is super relevant and up to date and like verified, so helpful, so helpful. In the same token, we're moving on to number 7. It's gonna be called Nerve Block. And this is a really cool app that I really found in the last year of medical school. I think I was just getting onto my anesthetics rotation for the end of the year. It is an app all about nerve blocks. So in different parts of the body, you can localize certain nerves. And if you introduce some anesthetic into that area, you can numb a particular area that you would need for particular presentation. Like maybe the patient has broken their hip and they need a block around that area to reduce some of their pain, or if you're about to do a procedure. So you can do like something called a digital block. It has which is a block for your finger. It has a picture of the human body, and then you just tap the area that you want to block in. So let's just go upper extremities. You click on that. You can go to the hand. Let's go to the hand anterior. And then, you know, it goes through specific blocks that you would want to do. So let's just go digital block. It goes through the indications why you would do it, the contraindications why you wouldn't, the specific equipment that you would need, and then the technique that you would use to do it. That's just awesome. It's really clean, it's really crisp and concise. There's nothing too tricky about understanding that. And sometimes they actually put in a video. Oh yeah, here we go. This is actually super helpful. So this is a median nerve ultrasound, a median nerve block. So it's one of the nerves that goes into the hand, and you want to maybe repair or get rid of the patient's pain. So it goes through the equipment when you wouldn't do it, and then using the ultrasound, so you can look here, it gives you an actual picture of where you would place the ultrasound and how the patient's hand would be. Then it, like, how good is this? It goes through an actual ultrasound image labeled. Ultrasounds are super hard to interpret, especially when you're first starting out. So to have this here, it's labeled. You got the ulnar, which is on the left side, and the radial, which is on the right. So radial's the one on the side of your thumb, just so you have a good idea about where everything is. And then it has all the structures labeled, and which, like, where the nerves are that you want to try to find. So, and then there's like a real life video, so you can see the needle going in around the nerve and then injecting the anesthetic, so it comes out. Yeah, see it expands, so it's being injected into the area. So I really find this helpful, even if you don't do a whole lot of procedural nerve blocks. Yeah, even if you don't do a whole lot of procedural nerve blocks, just to understand the anatomy and be aware of it is super helpful. And I mean, if you do a lot, then you know, just having this for reference is super helpful. So yeah, you can go through the list of all the different blocks, gives you some information about different local anesthetics and local anesthetic toxicities, the type of needle selection that you would use, and then of course a disclaimer. So nerve block, super helpful, super cool app. The last one that we want to go through is just a really handy one to have. It's like just a calculator system called the Opioid Calculator. It's made by our pain faculty in Australia and New Zealand, I think. So it essentially allows you to calculate the opioid equivalent doses when you compare and combine different opioid drugs. There's a lot of medication for pain out there, and you need to be able to understand if a dose of this medication, like something like tapentadol, is used with a dose of oxycodone. How does that compare in terms of the amount? Like, you need to compare them in one way or another. Usually you compare them in terms of morphine, and that's why it just says morphine oral milligrams per day at 1, and then it says oxycodone is 1.5 times as strong as morphine. So if I have 5 milligrams of oxycodone, 1.5 times that is about 8 milligrams of morphine oral. So you can compare them. Tapentadol is slightly less strong, so it's a third of it. So 25 milligrams of tapentadol is equivalent to 8 milligrams oral of morphine. And if you want to do, like, of course, IV medications are going to be more potent. So IV morphine, if you have 5 milligrams of that, then that's equivalent to 3 times that amount of oral morphine, so 15 milligrams. So yeah, you just, it's really handy to work out how much a patient's pain is getting controlled by the medication that's being used. So often if like a patient has super complex pain, then the pain team, which is a bunch of anesthetic, well, it really depends on the specific hospital, but people come round to assess complex pain in patients in the hospital. And one of the things they use to do is to compare the amount of medication that they're taking on any specific day. And if they're using more medication, or if it's staying the same, or if they're actually decreasing the amount of medication they're using. So you can see the trend in which the patient's going, which is super helpful. And because we use a whole bunch of different medications to help look after a patient's pain, you need to be able to compare it on some level. And having a really easy app like this, where you just tap, you know, the plus or the minus button, and you get an overall amount, you can see how that compares. Opioid Calculator, super, super helpful. I have a couple of others here if you want to hang around, and I'll quickly go through it. One of them I use periodically, very, very infrequently, but if I need to do an eye exam, I'll do it. It's called iChart HD. I just use it for the Snellen chart. So, you know, the Snellen chart is all those like letters, and I don't know why I'm showing you, it's on the screen next to me. It's all the letters that you use, and you have to like cover one eye and read from the top, and you can be like E, F, P, T, O, Z, and just to check like at what level can you not read anymore. So yeah, you assess your visual acuity by that, and you compare the eyes, etc. I use this because there's no Snellen chart that I've found that's lying around the hospital, unless it's in like an ophthalmology clinic. So it just says hold 1.25 meters away. That's pretty much the end of the bed, maybe a little bit further. You can just hold this up next to you and instruct the patient what to do, and then you get them to read. And it manufactures the traditional structure of the eye exam in terms of this Snellen's chart. So in hospitals, it's really cramped, there's really tight spaces. You just need a quick assessment of someone's visual acuity, and you need to do that as accurately as possible. And I'm not bringing a Snellen's chart to work, so the next best thing is the app on my phone. Yeah, I use that. You can randomize the letters. For some reason, you can use all these other charts. I'm not an eye doctor, so I've got no idea about all the other ones, but if you needed to use this tumbling E-grid, I don't know what to use that for. If you do know, let me know, because I've never used it before. Or the Sloan chart, just looks like the Snellen's chart, but a different font. So yeah, that's the iChart HD. That's super helpful on occasions. The next one is PaliMed. Now, we use, unless you're doing palliative care medicine, which is the field of making people comfortable and controlling their symptoms, It's usually associated with end-of-life care if people are headed towards that way, but sometimes it's literally just to manage symptoms for people who are not going to imminently pass away. You're just not going to treat the condition in a curative sense. So you can look, it's super helpful. You can go through specific symptoms in patients, particularly like say nausea and vomiting. There's different things like the haloperidol injection. It goes through when you would use it, the doses that you would require to use it at, gives you information on the medication and the types of symptoms that it would usually be used to control. And then for Australian purposes, it's just if it's PBS approved or not. And I mean, I won't really go into the details of that, but essentially it's like subsidized by the government versus not being subsidized by the government. And what else can we do? You know, there's different other symptoms. Maybe the patient is a bit agitated. You can use a liquid drop or you can use other types of injections. So the symptoms part of the app is super helpful. If you're just interested in learning more about a specific medication, you can go through that. Then it inversely refers to when you would use it for a particular symptom. Maybe they're in pain and that's how you would use it, prescribe it, what doses you'd start at, etc. And then it gives you like overall structures and guidelines and information about, you know, medication management, you know, for palliative care. It has specific information about like medico-legal, you know, information. It also has an opioid calculator built into it, which, you know, maybe I might not need the opioid calculator as a separate app. You can just use it in this. Type in how much, you know, the patient's using, and then it gives you a total equivalent of oral morphine. And it actually lets you switch. So if they're on oral tablets and they're not able to swallow anymore, maybe you want to swap it to an injection in the tummy, into the fatty tissue, the subcutaneous, or into a vein. You can choose a medication, and then it actually converts the total medications of all the tablets that you're using into a suitable alternative medication, even an alternative route of that medication. So I can, you know, switch from all those oral tablets, codeine and tapentadol, into a subcutaneous or IV preparation of hydromorphone, which is just a different opioid that you can deliver through a bit of fat in your tummy or into a vein. So that's actually amazing. I actually forgot about that. So that's the PaliMeds. That's all the apps I've got. If you have any other apps that you want me to talk about or review, let me know. But those are the apps that I have in my medicine folder on my iPhone that I have found super helpful over the course of my med school journey and even working as a junior doctor. Having things on your phone that you're able to access so quickly and just, you know, at the tips of your fingers, one of the best things that you can do. Yeah, all right, let's leave it there. I'll catch you guys next time.